Hello everyone. Here I'll be summarizing few points from the lecture of SLE. As you know, SLE is systemic lupus erythematosus. Systemic means various systems are involved: musculoskeletal, cutaneous, renal, nervous, vascular, pulmonary. And patient has some sort of symptoms going on once he develops SLE. Lupus usually indicates the disease slowly deteriorates. The term was earlier, but now with newer treatments, survival rate is increased. Erythematosus usually signifies inflammation. The damage is because of autoantibody formation or deposition of this immune complex into the organs, damaging the organs. Patients keep on experiencing symptoms. There is sometimes remission, or maybe there will be flare-up of disease. So let's look at the pathogenesis. Genetic factors, chances increase. If you have a twin, 30% chance, first degree relative, 6% of acquiring SLE. Environmental factors are important: sunlight, that is ultraviolet light, Epstein-Barr virus, infection. Females of reproductive age, the most susceptible population for SLE. Abnormal immune response. As you know, SLE is an autoimmune disease. So abnormal autoimmunity is, there are various factors which have been told. First is innate immunity, dendritic cells. Then low threshold of T and B cells towards the nuclear antigen. Improper regulation of T and B cells producing more antibodies against the own tissue. Complement activation in the body, causing inflammation and damage to various organs. Let's look at the diagnosis. Now, the earlier diagnosis told that any 4 of the 11 criteria should be fulfilled. However, the patient might not experience all these symptoms at one time. So, a recent change in clinical criteria was proposed in 2012. So, the clinical criteria include skin, acute and chronic. Acute include malar rash, chronic include discoid rash, painless oral or aphthous ulcers, non-scarring alopecia, synovitis is various joints involvement, renal involvement in the form of nephrotic syndrome, nephritic syndrome, even a renal biopsy showing SLE can be considered, neurologic ranging from cognitive impairment to seizures to headache to stroke, serositis, pleural and cardiac involvement, pleural effusion, hemolytic anemia, leukopenia and thrombocytopenia. So a single clinical criteria along with the immunologic criteria, so we can label the patients as SLE as well. So let's look at the immunological criteria, which include a non-specific antibody in patient's blood, that is anti-nuclear antibody. Specific antibodies are anti-dsDNA and anti-Smith antibodies. Third include anti-phospholipid antibodies, low serum complement and positive direct CUMs. ANA is sensitive antibody, dsDNA is specific. The antibodies are present before clinical features come into the patient, and serial ANA coming negative makes it SLE more unlikely. Let's look at some of the treatment options. The treatment options are divided as per how much the organ is damaged. So let's take, there is no organ damage, very less involvement. So we'll recommend for skin involvement, topical sunscreens or topical low potency glucocorticoids and NSAIDs. For serositis, hydroxychloroquine forms the main drug and will be used in mild and moderate cases of SLE. Its use includes skin, musculoskeletal involvement, and oral doses range from 200 to 400 mg daily. If it does not respond to above treatment, oral glucocorticoids like prednisolone or systemic glucocorticoids like methylprednisolone are used in cases of life-threatening disease or in case of flare-up of disease. In severe neurological disease, cutaneous involvement, serositis like cardiac involvement and renal involvement, and of course hematological abnormalities should be treated with glucocorticoids. For renal involvement or lupus nephritis, immunosuppressive drugs, mycophenolate mofetil or cyclophosphamide, given in an induction stage followed by a maintenance stage for months will help in getting remission of disease. Thank you for watching the video. Please subscribe to my channel. And this is just a summary of the topic. Please read full topic from the standard textbook. Thank you.